What's up everyone, this is Teimojin with Alone Season 9, and today we are diving deep in some of the medical concepts behind episode 4. So there's just so much good stuff that we're going to have to divide it in a few different videos, but today we're talking about TERI and constipation. So it's all going to be about poop, constipation, related injuries with that, and things to look out for, and how to treat it in the field if you were on Alone yourself. So let's get into it. For those of you who don't know me, my name is Dr. Tan. I am a medical doctor here in Canada, trained in the US, and I'm a former Army soldier, and I was on season 9 of Alone. One thing that I really love talking about is the medical side of survival, and specifically long-term survival. So if you like that type of content, consider subscribing and click the notification button, because each episode has a myriad of medical conditions and I'm gonna segment it off in different parts. So today it's all about poop, and we're talking about constipation and constipation-related injuries and illnesses. And as always, if there's a medical topic that you want covered, please let me know in the comments, and the more likes that comment has, or the more time that subject is brought up, I'll do that one next. So on season 9 episode 4, we see TERI complaining about constipation and saying that he has been backed up for about 13 days. So there are a few symptoms to look out for. One of them, just feeling bloated, obviously not pooping, but red flag symptoms is, are you passing gas? If not, you might have a complete obstruction, which is a surgical emergency. And with that, you'll likely notice some abdominal discomfort, some bloating, some nausea, and every little bit of food or water or fluids that you intake, you are likely going to feel nauseated and vomit that out because there's just not enough room. And in the emergency department and in the hospital, what we typically do is a decompression and give your belly a rest. So not eating a whole lot, not drinking a whole lot, everything's through the IV, and they put a tube that actually goes all the way down from your nose to your stomach to decompress that. And we get a lot of junk out that way, even sometimes stool. But if you are not having belly pain, you're not nauseous, and you're passing gas, and you just haven't gone in several days, what should you be looking out for? And why does this happen? We see so many people in this season and past seasons get constipation, and sometimes being backed up for more than 16 days. Likely the case, it is a combination of two main factors. One, not having an adequate amount of food source, so you're literally not eating enough for your gut to stay healthy and vibrant and contract. And oftentimes when it doesn't have enough food for a long amount of time, that muscles get weak, the little linings of your gut tract start to die off or get weaker, and you're just not able to squeeze as good as you used to. And without that squeeze, you can't push that poop down the line. And that weakness or atrophy of that first layer of the gut is really important, because that is where you absorb most of your nutrients. So not only are you having issues with constipation, if you are burning that inner liner, you are also having issues with absorption. More specifically, dairy products, so your lactase enzyme gets disturbed, and also your fat digestion, your lipase, and those types of enzymes that break down fats also get affected in that gut lining. So it is important as much as you can to eat. So you can supplement your diet with berries and do your research on the type of vegetation there and things that you can reliably eat. Every season when someone gets constipation, there's a little warning text that says that you can get more infections that way. And in some regards, that's plausible. As that gut lining gets thinner and as bacteria in your gut doesn't have as fast of a transit, it builds up in that area and can go through those layers into your bloodstreams. We see that in different conditions like pancreatitis, and is one of the reasons why we encourage early refeeding, because we want active transit of food through the gut system so it doesn't have that log delay and that opportunity for bacteria to transit from the gut into the bloodstream. The second issue, besides having enough food through your gut system, is water. A lot of the time people get dehydrated in expeditions and survival situations just like this. So it is super important to drink at least 3 to 4 liters of water daily to keep that gut active and also hydrated. The more dehydrated you are, the more your gut draws water from your poop and makes that stool harder to push down. So one of the common treatments for constipation in the field is increasing your water consumption to over 3 to 4 liters of water, and also increasing your fiber content. So it is important to know what plants you can eat. Out there we have berries, we have different vegetation, and we also have have different mosses and lichen that you can eat. But with things like different mosses and lichen, you do need to know how to process them because there is an extensive washing and boiling process that you need to do. Do you guys know what a lichen is? Let me know in the comments, and let me know what you think the nutritional value and what's in something like reindeer moss, because the answer might surprise you. I've also gotten some weird recommendations for constipation as well. There was someone who was commenting eating gravel to help things go down. I would not recommend it. That might tear up your gut pretty badly, and those jagged edges are more likely to damage you more than help you, especially on the way out. So what happens if you increase your fiber intake, you increase your water intake, and you're still having trouble pooping? What's the next step? Typically in the emergency department or the clinic, we give you medications from the top, and if that doesn't work, also medications from the bottom as well. So medications from the top, there are multiple different medical classes of medications that you take by mouth, things that are stimulating the guts, that actually stimulate the nerves to contract and push that poop down. There's osmotic agents that pull in water into the gut tract to make things slide out like a water slide. And there's things like added fiber, like Metamucil, which you can get over the counter. When we think about things that go in the butt, like enemas, these are contracting the end of your gut, basically your rectum, to push out that poop. Now there are things like fleet enemas, but one thing that you can realistically make out there if you have soap available, capability to make soap with fat and lye, which is white ash from wood, is a soap suds enema. So basically you're irritating your rectum to push out that poop. It wouldn't be my first option or recommendation, but here's something that I would do. So if you were to see me in the emergency department and we gave you medicines from the top, medicines from the bottom, and there was still a significant stool impaction, unfortunately, we're likely gonna have to use this. And obviously you would want to do this with a gloved hand and some lubrication of some kind, either warm water or spit, or a combination of the both. And you are going inside the rectum and physically removing stool with a finger. So to review, if you have constipation, increase your water intake, increase your fiber intake, and if needed, possible digital disimpaction. I don't think this topic would be complete without talking about hemorrhoids and bloody stools. So when I talk about blood on your stool, what's the first thing that comes to mind, and what are some of the things that you think might be going on? One of the most common things to happen when you have significant constipation is hemorrhoids. Hemorrhoids are an outpouching of gut tissue and blood vessels. And depending on where they are, it can be either painful or painless. People who've had painful hemorrhoids know exactly what that is. Painful hemorrhoids happen on the outside of the rectum, and you are able to feel that excruciating pain because the nerve system on the outside of the rectum are voluntary, so you can feel where it is. Kind of like if you were to run your finger along your skin, you can close your eyes and know where that is. Same thing goes for the nerves around the rectum, and that hemorrhoid is incredibly painful. It happens when you are straining a lot, like when you're constipated. It's kind of like blowing a blood vessel or popping a hernia, but in your butt. And again, the treatment's very similar. Increasing your water intake, increasing your fiber. In the interim, you might have several days where it's really uncomfortable while you're increasing your fiber, while you're increasing the amount of stool frequency, because it is pushing on that hemorrhoid. But as things slide out easier, that hemorrhoid should go away on its own. Now, one thing to look out for, if you have a mirror or a camera, you can look at your hemorrhoid to look at the color. Because if it is purple or black looking, that may be because the blood vessels are twisted onto itself, and that's called an incarcerated hemorrhoid, which often requires a surgical procedure or banding of that hemorrhoid. Oftentimes it is so painful to sit down that a lot of people sit on inflatable donuts. Now, we didn't have donuts out there, but what you could have used is the sleeves of your sweater. Stock that with debris or clothing, and you can use that to sit to give yourself some relief. And we can also take advantage of the nerve system around that rectal area. So on the outside, very sensitive, you can feel it. But on the inside, it's this diffuse type of, I don't know where it is, rectal discomfort. So nothing that you can pinpoint. Kind of the same when you get a gut issue. You don't know exactly where in that gut tract is that pain. Same thing when that hemorrhoid's on the inside. So you can take advantage of it by slowly putting pressure on that hemorrhoid to push it on the inside. And once it's on the inside, you don't feel it as much. So that goes back to bloody poop. So if you do not have a lot of pain, but you have blood on the outside of the stool, likely the case is is it's an internal hemorrhoid, something close to the opening of your anus that is bleeding. And because it's on the inside, it's not necessarily painful. If it's on the outside, yeah, external hemorrhoids can bleed a little bit. And so that hard poop from the constipation can go through that anus and then split it a little too much and then cause that fissure, which is incredibly painful and can bleed. So hemorrhoids and anal fissures are two reasons why you might have rectal bleeding on your stool. One very important cause of bloody stool is bloody diarrhea, and typically with a fever. So when we're thinking about fever and bloody things in your stool, we think about infectious causes. What happens is that bacteria is strong enough to break through your gut lining and go into your bloodstream. When it makes that first break, that's what causes the bloody diarrhea, because it is literally taking off layers and infecting that local area and going through that layer into your bloodstream. So fever and bloody diarrhea or bloody stools is a big concern. And oftentimes it's because we don't treat our meat properly, whether that's with adequate hygiene with your hands and your stool, how you're processing your meat, and how you're cooking your meat too. So if you want to learn more about that aspect, that hygiene and the infectious etiologies for gut problems, give me a follow, consider subscribing, and click the notification bell, because we'll be talking about it in the near future, because someone on season 9 had similar issues related to that. All right, that's all for today. Thank you so much for watching until the end. Upcoming next, we have topics like submersion injury, drowning, hypothermia, and how to treat it, how to differentiate moderate and severe hypothermia, and all those gut issues you likely have questions about. So let me know in the comments what questions you have about drowning, hypothermia, and gut problems, and I'll address it in the next video. My parting question to you is, what would you use for toilet paper out there? We had a discussion, a Q&A with Tom, and he had a very interesting choice. Check out our Q&A with Tom, Terry, and Juan Pablo to see what he used out there. Me personally, I love that tenderness and softness of moss that is just warm to a nice room temperature. But let me know what you would use. So this is Dr. Tan signing out.